Member for Saanich North and the Islands.
Yeah, thank you, Mr. Speaker. Yesterday, the Legislature's own Committee on Drug Toxicity recommended a full review of the Mental Health Act. They call it outdated. We've heard this before. The committee that I sat on, Mr. Speaker, the committee reviewing the Police Act, also called for a full review of the Mental Health Act. It's clear that we need to change the mental health services in this province. But instead of looking at the system as a whole, what we've seen this government and this minister do is invest in a system that's clearly broken. It's a Band-Aid solution. It's not working. And the legislature has heard that time and again. In fact, members of this House have come together twice now and implored the government to change and to review the Mental Health Act. So through you, Mr. Speaker, to the minister, when can the public expect a full review of the Mental Health Act?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. The system of care that we are working hard to build is what I hear families and people on the front line call for. They say it's decades overdue. And while we are fighting two public health emergencies, we are working with health authorities and with partners from every sector of our province and people in particularly with lived and living experience about what they need right now. And our very first priority is getting the crisis supports, getting the mental health counseling, getting the programs in schools. And so that's why our first priority was not reviewing the Mental Health Act. It was providing services that people need. We are considering—
Members, please.
We're considering all the recommendations of the Select Standing Committee on Health in its review of my ministry's response to the toxic drug overdose crisis, reviewing all their recommendations, with gratitude to the hundreds and hundreds of people across the province that put their personal experiences and their lives on the line. That's what I'm focused on, is what people with lived experience.
Members, if you want to ask a question, you have to give it time for an answer. Please continue.
My very first focus is building up the voluntary system of care and the supports that people are asking for. A review of the Mental Health Act is something that our government certainly has under consideration and will get to.
Member for Saanich North and the Islands, supplemental.
Thank you, Mr. Speaker. While this minister and other ministers are reviewing the recommendations that have come now from two committees made up of colleagues of this Legislative Assembly, imploring the government to review the Mental Health Act, the one as late as just yesterday that table was reported, a report was put on the table. The reality of it is that we have known that this has been a problem for a long time. They're reviewing the recommendations, and we're investing millions of dollars in a system that is fragmented and broken. That is what we're hearing time and time again from those people that are coming and submitting their feedback to these committees. The Mental Health Act is actually overseen by the Minister of Health. And so what we have here is we have a Mental Health Act. We have two ministers that oversee this. This law that we have is working against creating a better system of mental health. No amount of money that this minister and this government is going to invest in it will change that. It's like trying to eat soup with a fork, Mr. Speaker. The Police Act Committee, the Mental Health Act Committee, or the Police Act Committee and the Health Committee have both said review the Mental Health Act. It echoes the representative of children and families, the Ombudsperson, and several community organizations. My question is to the Minister of Health. Will he commit to reviewing the Mental Health Act?
Minister of Mental Health and Addictions.
Thank you, Mr. Speaker. I will say again, in a time of two public health emergencies, our focus, very first of all, is on standing up the supports that save people's lives right now, the work that needs to be done right now. We've created 100 new positions funding early psychosis intervention. Those interventions early can save young people from a lifetime of struggling with psychosis. We've added almost 50,000 new positions or places where people can connect with mental health counseling. We're funding the health authorities to offer culturally informed Indigenous healing service provision. And in time, we will, I'm sure, together review the Mental Health Act, but I'll point to where we do in a surgical way the interventions that advocates and people with lived experience ask us for right now. It was just this spring that in this chamber, an amendment to the Mental Health Act to provide rights advice service was introduced and initiated by the Premier designate, incoming Premier. That's the kind of work for the first time in British Columbia's history, providing rights advice service for people who are admitted involuntarily under the Mental Health Act. That is the kind of immediate work, and that our government has proved again and again. We will intervene and make changes where people ask us to in the way that actually affects lives right now.